the big shift in attitude that you guys are trying to push amongst officers dealing with that stuff?
Yeah, so I guess this is where my passion lies, and I say that because so we look at health and safety, and we've always been very safety conscious. We're very, very good at doing the safety stuff. We have to be, you know, and physically we ensure that our people are, you know, physically fit and well. We've always had a wellness service in place for like 40 odd years, and but it's, I guess, traditionally been very much about a response to attending incidents or response to trauma. So, you know, our guys go off to numerous jobs that they're exposed to that they probably never thought they would actually be going to as a cop, because we, just as an aside, but, you know, like if you watch those silly TV programs about police, it's all the fun kind of stuff. You don't ever see the actual stuff that we deal with around dead bodies and advising people of some pretty awful things and all of that kind of thing. So, yeah, so for me and my current role, it's really about breaking down stigma around mental health, having our staff feel that they can speak up and say, I'm not feeling okay or I'm not okay, and then having the appropriate services in place to support our guys. And the old school, you know, big burly cop, you know, really staunch, couldn't, you know, be seen to cry or show their emotions. Actually, you're human, and you can't tell me that you don't feel anything. You can find ways of coping and managing, but you wouldn't be human if you didn't feel something when you deal with people or you see trauma. So for us, it's about really driving the mental health wellness component across the organisation, and in saying that, ensuring that our people have really good education, access to resources that, one, sets them up to be really resilient, but also services there for when they do actually need them, they can go and see. So we have wellness advisors in every district. We have a chaplaincy service. We have access to psychologists throughout the whole country, and we offer basically as much as we can to our people to go and see psychologists. We have a range of other, I guess, policies and practices in place that ensures people that are being regularly exposed to trauma are actually getting ongoing supervision with a clinical psychologist, so they don't get to that point where they're at breaking point and then they need support. So we've got a range of things in place that actually support our people.
Got you. And I guess like having those things is all good and well, but like how do you get people actually to use them?
Yeah, so so that is the challenge, and I think, you know, as we bring in more diverse people into the organisation, that helps, because there's not just that traditional siloed kind of big staunch cop who can't, you know, show their emotions. So right from day one of them coming into college, our team go in and talk to them about, actually, you know, this is police, you are you, these are our services. We have an online called a wellness hub, but basically it's a portal where we are constantly feeding information, access to resources, advice for staff and also their families, because it's really important that families understand what's happening to their individual. So so there's the education and ongoing training and support for our people. What we've found, the best buy-in you get about changing sort of mindset around mental health is having our own staff tell their personal stories, because you know, you can have some academic tell you all this
or the
stuff.
Organization telling you need to do this.
Yeah, but when you get and I use the example because it's a real example of a dog handler.
Just get the mic a tiny bit closer.
Oh, sorry.
You're all good. You're fine.
So, example of a dog handler, when he can go and put his video and talk online, which goes on our wellness hub, to everybody about how he went through the death of or a suicide of a colleague, and how it impacted him and how he reached out for help, that kind of thing. those kind of real stories from our people are what start to get that change in mindset. We're finding our guys are really, I say guys and girls are really willing to actually speak up and talk about when they've suffered mental health, episodes, and there's nothing wrong with that. It's really just how do we ensure that stigma is removed and people can feel safe to actually talk about it, because that's the only way that you really get buy-in from people to want to do something different or get some help.
Is there still like a legacy of like the big man?
I think there's always going to be an element of that.
Sure.
We'd be I think naive to say, oh no, we don't have that. Everybody's we've got 14,000 plus in our organisation, so it's a big organisation. But we are seeing more and more people take up our services. We've got EAP as well, so that's access to counselling and support. So more and more people take that up, and it's probably more from that early, more prevention aspect rather than waiting till something really bad
wait until it breaks, then you have to fix it.
Which is cool. But like if I can do nothing more than in the time that I'm in this current role, it's to break down that stigma as much as I can and ensure that the support is there for our guys. Yeah, that is massive, and I think that's happening across a lot of organizations too. When I was working at MB, it was the exact same thing. Very much like this, not stigmatizing, and I think that's changing societally as well. The stigma of mental health and just being aware of certain things. Hey, if you enjoyed that, make sure you hit that subscribe button on the left-hand side, and to watch other episodes, click one of those squares on the right. If you only want to listen to this and don't have time to watch the full video, you can find this podcast wherever podcasts are listened to online. Thanks. Bye.